Richard Miguel, and I'm here to discuss to you guys the condoms and safe sex. So first of all, the condoms. Condoms are the best available protection against STIs by acting as a physical barrier to prevent the exchange of bodily fluids such as semen or vaginal fluid between two opposite sex. And safe sex is also called safer sex to highlight the fact that condoms and other barriers are not that 100% effective in preventing STIs or other transmissible disease. However, condoms do offer the best available protection when having sex with someone if it's used correctly. Also guys, if used correctly, condoms can dramatically reduce the risk of having sexually transmissible disease or infections like STIs, and you will be also able to avoid the unintended pregnancy, which is number one issue in our country right now. So I advise to all of you guys to use condoms so you will be able to avoid unnecessary things or issues and problems. That's all. About safe sex. Safer sex means having sex with you and your partner when you are ready. Having sex with your partner must be enjoyable, and they also must respect you, and you also must respect them. And always don't forget to use protection if you don't want to have any consequences. So the one thing I can advise is that when both of you will have sex, you must get each other's permission, so both of you will be ready when something happens. That's all. Thank you.
Increasing the risk of unsafe sex. Some of the factors that can make unsafe sex more likely include being drunk, which may lead you to being less careful, using recreational drugs, feeling pressured to have sex, thinking that it is okay just this once, believing that you can tell if someone has an STI because they will have symptoms. High risk of unsafe sexual activities. Unsafe sex outside of the monogamous relationship increases your risk of getting a STI. Examples of unsafe sex activities includes having sex without a male or female condom, withdrawing the penis before ejaculation instead of using condoms. Pre-ejaculative fluid may be infectious and can also contain sperm, resulting in pregnancy. Trying to reuse a condom or using a condom that is past use by its date. Using a condom incorrectly or continuing to have sex once the condom is broken. Exchanging bodily fluid like menstrual blood, semen, or vaginal fluids inside another person's body. For example, mouth, vagina, or anus. What to do if you have unsafe sex? If you had unsafe sex, avoid vaginal or rectal douching or washing out or irrigating these areas with water or other fluids, as the irritation to delicate tissues could increase the risk of infection. Make sure you are not at risk of pregnancy. Consider taking the emergency contraceptive pill within 72 hours is best, but it can be taken with 120 hours of unprotected sex or a broken condom if no other form of contraception was used. See your GP promptly to be tested for STIs. Consider past exposure prophylaxis or PEP to prevent HIV. If you're a man who has had unprotected anal intercourse with another man, call PEP line to assess whether you require post-exposure prophylaxis.
Overcoming barriers to safe sex. Learn how to use condoms. They may take a little getting used to, but it's better than catching on STIs. Involve condoms in foreplay. Hormonal contraceptives such as the oral contraceptive pill only provides protections against unplanned pregnancy. They provide no protections against STIs. Prioritize your sexual health. It is important. Don't think you can tell someone has an STIs by looking at them. Most STIs don't have obvious signs. Educate yourselves about STIs. Anyone who has sex, it is a risk. Safe sex myths. Some people believe or may persuade you of various myths about safe sex, such as planning ahead for a sex ruins the mood. You can tell by the way someone looks like they don't or do have an STI. Practicing safe sex implies that one of us has an STI. Practicing safe sex implies that one of us is an intravenous drug user. Lesbians don't get STIs. Taking the pill means a practice of sex.
Hello, may isi-share lang ako kung ano ang kaalaman ko sa topic na ito. So, may friend ako na kasing age ko lang, 16 years old and nabuntis siya. Hindi niya alam kung ano ang mga gagawin niya at hindi niya agad nasabi sa parents niya kasi nga mapapagalitan siya. Kaya bilang kaibigan ay sa akin siya nag-open. Pero nahirapan din ako na pagtakpan siya. Kaya pinilit ko na lang na sabihin niya sa magulang niya. And yes, napagalitan niya siya. Pero dahil andyan na yun ay wala nang nagawa yung parents niya. So, ang realization ko dito ay dapat iniisip muna natin yung mga bagay bago natin gawin dahil sa huli ay tayo lang ang magsisisi dito. At bago tayo gumawa ng ganito ay dapat maging educated tayo sa lahat ng bagay at sa ating mga responsibilidad. Isa pa ay lagi nating tandaan na sa lahat ng ating ginagawa ay hindi pa tapos ang ating buhay. Dahil sa mga ganitong sitwasyon ay isa itong panibagong buhay para maging isang mabuting ehemplo sa ating mga anak at sa ibang tao.